Joined by Francisco Gimenez, Director of the Balmis Institute of Vaccines and Pediatrics Coordinator at the Hospital Vitas Maria. Dr. Gimenez, tell me, has COVID-19 raised the profile of vaccination across all ages and stages of life in your country?
Thank you, Gary. I must say that generally speaking, at the beginning of the pandemic, the uptake decreased among all ages, but it improved after a few months. However, coverage has stayed low among teens. Some vaccines like human papillomavirus, meningococcus, or tetanus have gone unvaccinated, which could leave thousands of teenagers unprotected. Indeed, many governments and institutions are currently trying to encourage young people to be vaccinated. So surprisingly, the flu vaccination among elderly people in Spain has had its highest uptake in the last season, which is a surprise for us.
How has your government and your fellow citizens responded to COVID-19 vaccination?
It's a good question. In general, we've had a very good response from most of the populations. The uptakes reached 80% in a few months in Spain. Many institutions, including governments, have fought fake news using the media to offer contrasting information. The response of citizens has been much better than we expected in the beginning, particularly that of adolescents, which was very good, in spite of the false information which they sometimes read on social media. At this point, it's very important to use these channels to inform young people, which is very, very important.
Finally, what needs to happen post-COVID-19 in your country to encourage routine immunization and all the vaccination programs that the country provides?
In my opinion, life course immunization has been reinforced as a result of the pandemic. In contrast, on the other hand, some people still have doubts about vaccines. We should continue offering scientific information using channels like social media. Going forward, strategies and lessons learned during the pandemic can be applied to other vaccines with a view to improving uptake. We mustn't forget that there are other preventable diseases that may reemerge, like measles, meningococcal disease, or even influenza. For example, some regions in Spain are taking advantage of the resources they used for COVID-19 vaccinations for other campaigns. I think this is a great strategy for the future. Currently, from the Balmis Institute of Vaccines, we are working on a new project trying to analyze fake news about vaccines on Twitter, trying to clarify their origin, which is very difficult sometimes.
Thank you, Dr. Gimenez. That is fantastic, and I really appreciate your time.
Thank you, Gary. Thank you for your effort with your work.